Chapter 4, Reproductive Health. So now we will do the reproductive health chapter. In the previous video we have already done the reproduction in humans. So here starting with the introduction part. You have learned about human reproductive system and its function in chapter 3. Now let's discuss a closely related topic, reproductive health. What do we understand by this term? The term simply refers to the health and of organs with normal functions. It refers simply to the healthy reproductive organs with normal functions. However, it has a broader perspective and includes emotional and social aspects of reproduction also. According to WHO, World Health Organization, WHO is World Health Organization, reproductive health means a total well-being in all the aspects of reproduction, that is physical, emotional, behavioral and social. So what does reproductive health mean? According to WHO, it is a complete state of physical, emotional, social and behavioral well-being. Therefore, a society with people having physically and functionally normal reproductive organs and normal emotional and behavioral interaction among them in all sex-related aspects might be called reproductively healthy. Reproductive health and problems and strategies. India was amongst the first countries in the world to initiate action plans and programs at national level to attain a total reproductive health as a social goal. These programs, called family plannings, were initiated in 1951 and were periodically assessed over the past decades. Improved programs covering wider reproduction related areas are currently in operation under the popular name reproductive and child healthcare programs, RCH. So the family plannings were initiated in 1951 first, and then they are now running under the name of reproductive and child healthcare. Creating awareness among people about various reproduction related aspects and providing facilities and support for building up a reproductively healthy society are the major tasks under these programs. With the help of audiovisual and print media, government and non-governmental agencies have taken various steps to create awareness among the people about reproduction related aspects. Parents, other close relatives, teachers, friends also have a major role in dissemination of above information. Introduction of sex education in school should also be encouraged to provide right information to the so as to so as to discourage children from believing in myths and having misconception about sex related aspect. Proper information about reproductive organs, adolescence and related changes, safe and hygienic sexual practices, sexually transmitted diseases called STDs, AIDS, etc., would help people, especially those in the adolescent age group, to lead a reproductively healthy life. Educating people, especially fertile couples and those in marriageable age group, about available birth control options, care of pregnant mothers, postnatal care of the mother and child, importance of breastfeeding, equal opportunities for male and female child, etc., would address the importance of bringing up socially conscious, healthy families of desired size. Okay, so this is all it is not that necessary. Hardly any questions might come from this part. So this part is important. Amniocentesis. So these are essential to provide medical assistance and care to people in reproduction related problems like pregnancy, delivery, STDs, abortion, contraception, menstrual problems, infertility, etc. Implementation of better techniques and new strategies from time to time are also required to provide more efficient care and assistance to people. Statutory ban on amniocentesis for sex determination is legally check increasing menace of female feticides, massive child immunization, etc. are some of the programs that merit mention in this connection. In amniocentesis, some of the amniotic fluid of the developing fetus is taken to analyze the fetal cells and dissolve substances. This procedure is used to test for the presence of certain genetic disorders such as Down syndrome, hemophilia, sickle cell anemia, etc. So you must have read about this in the principle of inheritance. The Down syndrome, which is caused due to trisomy of 21st chromosome. Similarly, hemophilia caused by it is a X-linked recessive disorder. Sickle cell anemia, which is autosomal recessive disorder. They are all genetic disorders, and they can be uh, detected by doing this amniosynthesis. But the major misuse of this is also used to check the sex of the growing fetus, and that's why it is banned in India. Research on various reproduction related areas are encouraged and supported by government and non-governmental agencies to find out new methods and or to improve upon the existing ones. Do you know that Saili, a new oral contraceptive for females, was developed by the Central Drug Research Institute in Lucknow? Okay, so this is very important. Saili is a non-steroidal pill and a new oral contraceptive developed for females by Central Drug Research Institute, Lucknow. Better awareness about sex-related matters, increased number of medically assisted deliveries, and better postnatal care leading toward decreased maternal and infant mortality rates, increased number of couples with small families, better detection and cure of STDs, and overall increased medical facilities for all the sex-related programs, etc., all indicate improved reproductive health of the society. Population stabilization and birth control. In the last century, an all-round development in various fields significantly improved the quality of life of the people. Okay, however, increased health facilities along with better living conditions had an explosive impact on the growth of population. The world population, which was around 2 billion at the time of in 2019, rocketed to about 6 billion by 2000 and 7.2 billion by 2011. Okay, similar trend was observed in India too. In our population, that is, Indian population was around 350 million at the time of independence, reached close to billion mark by 2000 and crossed 1.2 billion in 2011. World population was 2 billion in 1900, then it rocketed to 6 billion in 2000 and now 7.2 billion in 2011. And Indian population was 350 million at the time of independence, reached close to 1 billion and crossed 1 billion by 2000, and then by 2011 it was 1.2 billion. A rapid decline in death rate, maternal mortality rate, and infant mortality rate, as well as increase in number of people in reproducible age are probable reason for this. The reason for this population explosion was that decrease in the death rate, maternal mortality rate, as well as infant mortality rate, as well as increase in number of people in reproducible age. These are the two main reasons for the population explosion. Through our reproductive child healthcare program, though we could bring down the population growth rate, it was only a marginal. According to 2011 census report, the population growth rate, okay, according to 2011 census, population growth rate was less than 2%. Okay, a rate at which our population could increase rapidly. Such an alarming growth rate could lead to an absolute scarcity even of basic requirements, that is food, shelter and clothing, in spite of significant progress made in those areas. Therefore, government was forced to take up serious measures to check this population growth rate. So now here this part is important. Statutory raising of marriageable age of female to 18 years and male to 21 years. The female marriageable age is increased to 18 years and male to 21 years. Now, okay, what is ideal contraceptive? An ideal contraceptive should be it is a contraceptive that should be user friendly, easily available, effective, reversible, with no or least side effects. It should in no way interfere with sexual drive or desire or the sexual act of the user. Okay, it should be easily available, it should be effective, it should be reversible, and with the no or least side effect, and it should not interfere in the sexual drive. A wide range of contraceptive methods are presently available, which could be broadly grouped into the following categories, namely natural or traditional, barrier, IUDs, oral contraceptive, injectable, implants, and the surgical methods. Let's first start with the natural methods. Natural methods are the traditional methods. They work on the principle of avoiding the chances of ovum and sperm meeting. It is again divided into three types: periodic abstinence, which is One such method in which the couples avoid or abstain from coitus from day 10 to day 17 of the menstrual cycle when ovulation could be expected. So generally, the menstrual cycle of 28 days, ovulation takes place on the 14th, but mostly in most of the cases there is deviation. So, but if we take 28-day cycle, then 14-day ovulation takes place. So the couple avoid or abstain from coitus from day 10 to day 17 of the menstrual cycle when ovulation could be expected, because sperms, they live alive for three three around 3 days, 2 to 3 days, and that's why they don't avoid just for the 14th day, but they avoid 10 to 17 days, the 4 days before ovulation as well as 3 days after ovulation, because sperm can uh, they remain alive even for 3 to 4 days. As chances of fertilization are very high during this period, it is called as a fertile period. This period, this 10 to 17 days, is called a fertile period. Therefore, by abstaining from coitus during this period, conception could be prevented. Second method is withdrawal or the coitus interruptus, in which male partner withdraws its penis from the vagina before ejaculation so as to avoid the insemination. Then the third one is lactational amenorrhea. Amenorrhea is the absence of menstruation. Method is based on the fact that ovulation and therefore the cycle does not occur during the period of intense lactation following parturition. So during parturition, as prolactin level is also very high and FSH and LH level is very low, uh, there is no menstruation taking place. Okay, so therefore, as long as the mother breastfeeds the child fully, chances of conception are almost nil. However, this method has been reported to be effective only up to a maximum period of 6 months from parturition. And as no medicines or devices are used in this natural method, side effects are almost nil. However, the chances of failure are very high. Second one is the barrier method. Barrier method, ovum and sperms are physically prevented from meeting with each other. They are prevented from physically meeting with the help of barriers. Such methods are available for both male and female. Okay, and there the first one is the condoms. Are barrier methods of thin rubber of latex or the latex sheath used to cover penis in male and vagina or the cervix in female just before coitus so that the ejaculated semen would not enter into the female reproductive tract. This can prevent conception. Neros is a popular brand of male condoms. There is a condom for male. Neros is a brand name. Use of condoms has increased in recent years due to its additional benefit of protecting the user from contracting STIs, that is sexually transmitted infection, and the AIDS. Both male and female condoms are disposable and can be self-inserted, thereby gives privacy to the user. Okay, then besides condoms, there are many other things like diaphragm, cervical caps, and vaults. These are the barriers made up of rubbers and are inserted into the female reproductive tract to cover the cervix during the coitus. They prevent conception by blocking the entry of sperm through the cervix. They are made up of rubber, they are reusable, and spermicidal creams, jellies, and foams are used along with this to increase their contraceptive efficiency. Another effective and popular method is the use of intrauterine devices, that is IUDs. These devices are inserted by doctors or the expert nurses into the uterus through vagina. Intrauterine devices are presently available as again they are of three types. One is non-medicated IUD, example is Lipis loop. Then copper releasing, example are copper T, copper 7, multiload 375, and the hormone releasing IUDs, example are Progesta CERT, LNG20. Okay, the copper releasing, that copper 7, copper T or copper multiload 375, they increase phagocytosis of the sperm. They increase what? Phagocytosis of the sperm, and the copper ions which are released, they suppress the sperm motility and fertilizing capacity of sperms. So the two main things they are responsible for this conception are they increase phagocytosis of the sperms and in the uterus, and the copper ion release uh, they suppress motility and the fertilizing capacity of the sperm. Hormone releasing IUDs, that is progesterone, LNG20 in addition, they make uterus unsuitable for the implantation. Okay, they contain actually progesterone, a synthetic progesterone, and this stimulates excessive growth of the endometrium. That's why implantation doesn't take place. It makes uterus unsuitable for implantation, and also makes cervix hostile to the sperm. So it prevents implantation, fertilization, as well as ovulation. It also prevents ovulation. IUDs are ideal contraceptives for females who want to delay pregnancy or space children. It is one of the most widely accepted methods of contraception in India. So IUDs are the most widely accepted contraceptive methods, okay, in India. Oral administration of small doses of either progestogens or progestogen estrogen combinations is another contraceptive method used by females. They are also called as pills. They are used in the form of tablets and hence are popularly called as the pills. Pills have to be taken daily for a period of 21 days, starting within first 5 days of menstrual cycle after a gap of 7 days during the menstruation. It has to be repeated in the same pattern till the female desires to prevent conception. They inhibit ovulation just like the hormone releasing IUDs. They inhibit ovulation, implantation, and fertilization. They alter the quality of cervical mucus to prevent or retard the entry of sperm. That is, they make cervix hostile to the sperm. Pills are very effective with lesser side effects and are well accepted by the females. They are actually steroidal pills. But now, a Saeli, which is a non-steroidal pill, is developed by Central Drug Research Institute, Lucknow. It is a new oral contraceptives for females. Contains non-steroidal preparation. It is once a week pill. It is taken only once a week, not daily. The progestogen or the progestogen estrogen combination pill, they are taken for a period of 21 days. First, there are actually two types of them. Progestogen only pills, also called as mini pills, they are taken daily, and progestogen estrogen combination taken for 21 days, starting within first 5 days of pregnancy, menstruation, then a gap of 7 days where when the menstruation occurs, and then daily. But here the Saeli is a once a week pill with very few side effects and high contraceptive value. Progestogens alone or in combination with estrogen can also be used by females as the injections or the implants. Implants also called as a norplant and under the skin. Okay, their mode of action is similar to that of the pills and their effective periods are much longer. Okay, in case of the implants, the effective period are much longer. Administration of progestogen or the progestogen estrogen combinations or IUDs within 72 hours of the coitus have been found to be very effective as emergency contraceptives, as they could be used to avoid pregnancy due to rape or casual unprotected intercourse. Surgical methods, also called as sterilization, they are generally advised for the male or female partner as a terminal method and they are irreversible. Surgical methods are terminal methods to prevent any more um, pregnancies. Okay, the surgical intervention the surgical intervention, it blocks gamete transport and not the gamete formation. So gamete formation occurs but gamete transport is inhibited and thereby prevent conception. In males it is called vasectomy because a part of vas difference is cut and tied. So in this diagram you can clearly see here the part of vas difference is cut and tied. Similarly here, that's why it is called as a vasectomy. Okay, And in females, it is called as a tubectomy or tubal ligation because a part of the oviduct or the fallopian tube is cut and tied. In vasectomy, a small part of the vas deferens is removed or tied up through a small incision on the scrotum, whereas in tubectomy, a small part of fallopian tube is removed or tied up through a small incision in the abdomen or through vagina. Okay, so yeah, in this diagram, it's given that a part of fallopian tube is cut and tied. Here also you can see it is cut and tied through incision in the abdomen or through the vagina. So these techniques or the sterilization are highly effective, but the reversibility is poor. It needs to be emphasized that the selection of suitable contraceptive methods and its use should always be undertaken in consultation with the qualified medical professionals. One must also remember that contraceptives are not regular requirements for the maintenance of the reproductive health. In fact, they are practiced against a natural reproductive event, that is conception or the pregnancy. One is forced to use these methods either to prevent pregnancy or to delay or space shield pregnancy due to personal reasons. No doubt, the widespread use of these methods have a significant role in checking the uncontrolled growth of population. However, there are possible real effects like nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, or even breast cancer, though not very significant, should also not be totally ignored. So these are the side effects. Now, coming to the medical termination of pregnancy, also called as the MTP. It is what? It is the intentional. It is intentional or voluntary termination of pregnancy before full term. It is called a medical termination of pregnancy or MTP or induced abortion. Only 45 to 50 million MTPs are performed in a year all over the world, which accounts for 1/5 of the total conceived pregnancies in a year. So there are around 45 to 50 million MTPs performed in a year all over the world. MTP is intentional or the voluntary termination of pregnancy before the full term, also called as a induced abortion. And MTP is not being okay. So whether to accept or legalize MTP or not is being debated upon in many countries due to emotional, ethical, religious, and social issues involved in it. Government of India legalized MTP in 1971. This year is very important. In this chapter, there are two important years. One is the family planning program that was initiated in 1951, and then MTP. Government of India legalized MTP in 1971 with some strict condition to avoid its misuse. Such restrictions are also all the more important to check indiscriminate and illegal female feticides, which are reported to be high in India. Why MTP? Obviously, the answer is to get rid of unwanted pregnancies, either due to casual unprotected sexual intercourse or failure of contraceptives used during coitus or due to rapes. MTPs are also essential in certain cases where the continuation of pregnancy could be harmful could be harmful or fatal either to the mother or to the fetus or both. MTPs are considered relatively safe up to the first trimester, that is 12 weeks or first 3 months. They are relatively safe during the first trimester, the first 3 months up to the 12 weeks of pregnancy. Second trimester abortion are much more riskier. One disturbing trend observed is that a majority of MTPs are performed by unqualified quacks, which are not only unsafe but could also be fatal. Another dangerous trend is the misuse of amniocentesis to determine the sex of unborn child. Frequently, if the fetus is found to be female, it is followed by MTP. This is totally against what is legal. Such practices should be avoided because these are dangerous both for the young mother and to the fetus. Effective counseling on the need to avoid unprotected coitus and risk factors involved in illegal abortion, as well as providing more healthcare facilities, could reverse the mentioned unhealthy trend. Now, coming to the very important point, sexually transmitted infections, also called as the STIs. So, infections or the diseases which are transmitted through sexual intercourse are collectively called as sexually transmitted infections (STIs), or venereal diseases or reproductive tract infection RTI, gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course, the most discussed infection in recent years, HIV, leading to the AIDS, are some of the common STIs. Among these, HIV infection is the most dangerous and is discussed in chapter 8. Some of these infections like hepatitis B and HIV can also be transmitted by sharing the injection needles, that is through blood transfusion, even through contaminated needles, surgical instruments, etc. with infected person, transfusion of blood, or from an infected mother to the fetus too. Except for hepatitis B, genital herpes, and the HIV infection, other diseases are completely curable. Genital warts is a viral disease, but it is curable. The only thing is they are completely curable if detected early and treated properly. Curable, this is true for all the diseases. Those which are curable, they are completely curable only if they are detected early and treated properly. Early symptoms of most of these are minor and include itching, swelling, fluid discharge, slight pain in the genital region. Infected females may often be asymptomatic and hence may remain undetected for long. Absence or less significant symptoms in the early stages of infection or the social stigmas attached to the STIs deter the infected person from going for timely detection and proper treatment. This could lead to complications later. The complications include pelvic inflammatory diseases, PIDs, abortions, stillbirths, ectopic pregnancy, that is pregnancy taking place outside the uterus, infertility, or even the cancer of reproductive tract are the complications. What are the initial symptoms? Itching, swelling in the genital regions, slight pain, and uh, yeah, that's it. But the complications are pelvic inflammatory diseases, ectopic pregnancies, cancer of reproductive tract, stillbirths, abortions, infertility. STIs are major threat to a healthy society. Therefore, prevention or early detection and cure of these diseases are given prime consideration under the reproductive health care programs. Though all persons are vulnerable to this infection, their incidences are reported to be very high among the persons in the age group of 15 to 24 years, the age group to which you also belong. There is no reason to panic because prevention is possible. One could be free of these infections by following the simple principles given below. Avoid sex with unknown partner or multiple partners. Avoid always try to use condoms during coitus. In case of doubt, one should go to a qualified doctor for early detection and get complete treatment if diagnosed with a disease or the infection. Infertility. A discussion on reproductive health is incomplete without a mention of infertility. A large number of couples all over the world, including India, are infertile. That is, they are unable to produce children in spite of unprotected sexual cohabitation. The reason for this could be many: physical, congenital diseases, drugs, immunological, or even psychological. In India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. Specialized healthcare units, infertility clinics, etc., could help in diagnosis and corrective treatment of these disorders and enable these couples to have children. However, where such corrections are not possible, the couples could be associated to have children through certain special techniques, commonly known as assisted reproductive techniques, ARTs. First one is in vitro fertilization. Fertilization taking outside the body is called in vitro. It's almost similar condition that is in the body, followed by embryo transfer. Is one such method. In this method, popularly known as test tube baby programs, ova from a female or a donor and sperms from a husband or a donor male are collected and induced to form zygote under the simulated conditions in the laboratory. Okay, so zygote is formed outside the body. Fertilization takes place outside the body. That's why it is called in vitro fertilization. And then zygote are early embryos up to the 8 blastomeres is transferred to fallopian tube. This is called zygote intrafallopian transfer. And embryos with more than 8 blastomeres are transferred into uterus. It's called intrauterine transfer to complete its further development. Embryos formed in vivo fertilization, fusion of gametes within the female, also could be used for such transfer to assist those females who cannot conceive. Transfer of ovum collected from a donor into the fallopian tube is called gamete intrafallopian transfer in the females who cannot produce the ova but can provide suitable environment for fertilization and further development. Intracytoplasmic sperm injection. This is also a type of in vitro fertilization because fertilization takes place outside the body in the laboratory. But here in intracytoplasmic sperm injection, the embryo is formed in the laboratory in which sperm is directly injected into the ovum to form the embryo, to form the zygote. Okay, so that's why it is called as intracytoplasmic sperm injection. Infertility cases, either due to inability of male partner to inseminate the female or due to very low sperm count in the ejaculate, that is called oligospermia, could be corrected by artificial insemination technique. Okay, in which semen is collected either from the husband or a healthy donor and is artificially introduced into the vagina or in the uterus. Then it is called intrauterine insemination. Though options are many, all these techniques require extremely high precision handling by specialized professionals and expensive instrumentation. Therefore, these facilities are presently available only in very few centers in the country. Obviously, their benefit is affordable to only limited number of people. Emotional, religious, and social factors are also deterrents in the adoption of these methods. Since the ultimate aim of all these procedures is to have children, in India we have so many orphan and destitute children who would probably not survive till maturity unless taken care of. Our laws permit legal adoption, and it is as yet one of the best methods for couples looking for parenthood. So we are done with this chapter, and here is the summary. If you want, you can go through it and try to solve as many MCQs as you can to prepare for the NEET. So that's it, guys. In the next video we'll probably do the principle of inheritance chapter, or I'll see if any other chapter is if you want, then you can just message me in the this comment box, or I'll pick up a chapter and we'll start with that. So thank you for watching my videos, and please like if you like it and share it.